Hello, I am Abraham Peña. I'm gonna talk about Pyoderma gangrenosum and ulcerative colitis. Pyoderma gangrenosum is a rare inflammatory, non-infective, and non-neoplastic skin disorder. PJ is often associated with systemic conditions such as an inflammatory bowel disease, such as an ulcerative colitis, rheumatoid arthritis, and parathroproteinemia, and hematologic malignancies. The precise clinical and pathologic association of PJ with an underlying systemic disease is currently unknown. Conventionally, it was thought that PJ was not a manifestation or complication of this disease, and the relationship of PJ and combined disease during their clinical courses is not fully understood.
Pyoderma gangrenosum. Pyoderma gangrenosum is a neutrophilic dermatosis that presents as an ulcerative skin disease. It starts as an inflammatory papule or pustule and may progress to become a vesicle or a nodule and can eventually form an expanding purulent ulcer. Pyoderma gangrenosum can present as a single or multiple lesions, usually on the trunk or lower extremities. It is most commonly triggered by a local trauma due to pathergy, neutrophil dysfunction, and dysregulation of the immune system due to an underlying systemic inflammation are major contributors towards pathogenesis of Pyoderma gangrenosum. At least half of the patients with Pyoderma gangrenosum have an associated underlying systemic disorder, such as an inflammatory bowel disease, or arthropathies, or solid organ malignant conditions, or hematologic malignant neoplasms like acute myeloid leukemia or other hematological conditions like myelodysplastic syndrome. Pyoderma gangrenosum is diagnosed based on histologic criteria and history and clinical exam findings along with treatment findings. The major criterion is biopsy of the ulcer edge demonstrating a neutrophilic infiltrate. The minor criteria include an exclusion of infection, pathergy positive, personal history of inflammatory bowel disease or inflammatory arthritis, history of a papule or pustule or vesicle that rapidly ulcerated, peripheral erythema, undermining border and tenderness at the site of ulceration, multiple ulcerations with at least one occurring on an anterior lower leg, and cribriform or wrinkled paper scars at the site of heel ulcers, and decrease in ulcer size with 1 month of initiating immunosuppressive medications. Treatment typically requires local corticosteroid or calcineurin inhibitors for limited disease and systemic corticosteroids or cyclosporine for widespread or rapidly progressive disease.
What is ulcerative colitis? Ulcerative colitis, or UC, is an inflammatory bowel disease. It causes irritation, inflammation, and ulcers in the lining of your large intestine. Doctors aren't sure why people get the condition. Your genes may play a role. The disease sometimes runs in families. Other things in the world around you make a difference too. The development of PJ is one of the more severe extraintestinal manifestations of IBD, with the potential for both significant morbidity and have a big impact on activities daily and living and quality of life. Severe disease can be cosmetically disfiguring and may lead to permanent scarring, significant pain, bacterial infection, and skin grafting. Moreover, we can use as therapeutic like cyclosporine or anti-TNF agents. Applications in medicine. This intriguing overlap and potential link is further supported by the association between perinuclear antineutrophil cytoplasmatic antibodies, or named ANCAs, A serologic marker often detected in patients with colonic IBD, including USC and UC-like CD phenotypes, with number of EIM, such as uveitis. This makes it possible to identify possible future problems in advance and apply timely treatment. Well, continue with the pros. Bowel disorders can be treated with corticosteroids and infliximab. This medicine also can benefit skin conditions.
Pyoderma gangrenosum is a non-infectious, progressive, necrotizing skin condition. The etiology of pyoderma is unclear. Half of patients have a systemic inflammatory condition, such as ulcerative colitis, Crohn's disease, irritable bowel syndrome, lupus, or rheumatoid arthritis. About a quarter of pyoderma cases begin after some sort of trauma or surgery, but another quarter have an insidious onset. Pyoderma most frequently affects patients who are middle-aged. The pathology of pyoderma gangrenosum is poorly understood, but is believed to be due to neutrophil dysfunction. The classic presentation of Pyoderma gangrenosum begins as a small, very painful papule, vesicle, or pustule on the lower extremities and/or trunk. While a single lesion is possible, generally there is a cluster of ulcerations that rapidly expands. Pyoderma rapidly progresses to full-thickness ulcerations with irregular, violaceous borders which have purulent and hemorrhagic exudates. Undermining is common. The wound bed is eschar or slough covered, and the wound edges may be rolled. The peri wound is indurated or boggy. The patient may also have fever, malaise, or myalgia. Pyoderma lesions are erythematous due to inflammation, but may also have a blue hue from epidermal necrosis. Immunosuppressive and anti-infective agents are commonly prescribed. Corticosteroids are used to control inflammation. Local wound care includes gentle and limited debridement of slough and necrotic tissue. Extensive sharp or surgical debridement is contraindicated because it increases the inflammatory response, leading to severe exacerbations. Topical antimicrobials are indicated for sensitive bacterial infections. Gauze or moisture-retentive dressings should absorb wound exudate and protect the surrounding tissue. Extremity wounds may benefit from elevation and gradient compression. Negative pressure therapy and hyperbaric oxygen have been used with some success. Wounds that have stabilized with medication have been treated successfully with skin grafting. Wound healing is extremely slow. Because recurrence is common, physicians generally continue pharmacological management for 6 to 12 months after wound closure.
At cons, the exact cause of pyoderma granulosum are still unknown. Ulcers of pyoderma gangrenosum proliferate very fast, and complications of pyoderma gangrenosum include infections.
We've shown you photos of some extreme medical conditions over the years, and today we have some of our most shocking yet. It's time for What is this? What happened? And could it happen to me? So let's start with this picture. And as you all try to figure out what happened and could it happen to you, Dr. Batra, what did happen?
So this is actually a very zoomed in picture, and I think if you go back, you'll actually see the part of the normal skin on the breast. This is a condition that's really quite rare. It's called Pyoderma gangrenosum, and it's a condition where when you have an injury to your skin, in this case, the picture is taken from a woman whose photo went viral. She was scratched by a cat. But what happens is all of these inflammatory cells rush to try and heal the injury, but they get stuck, and they're an overabundance of cells called neutrophils. And the way I always kind of think of this in my mind is like when there's an accident and all the bystanders are in the front lines, that the first responders can't get there and actually fix the problem. That's what's happening here. You actually have all of these inflammatory cells that are not meant to be there crowding out the actual wound healing that's meant to occur. So anytime someone gets an injury, it just becomes this horrible, painful, non-healing ulcer. And this is actually really challenging to diagnose because you have to rule out all sorts of infectious causes and other possible reasons for this. You have to diagnose this on biopsy. It's much more common in people with other autoimmune conditions or certainly inflammatory bowel disease. And it's treated by very long courses of anti-inflammatories. So sometimes we were just talking about a couple of cases of mine in my clinic where it's taken months to years of long-term steroids or anti-inflammatories to actually make this get better, and does heal with pretty significant scarring as well.
So having the diagnosis of an autoimmune disease really helps you pinpoint that it's probably that, right?
Absolutely, but dermatologists always consider this sort of a diagnosis of exclusion because you can't just assume they have this horrible, painful ulcer. Just because of this, you're going to end up having to rule out other sources of infection, and pretty much it's a dual-edged sword. When you do the biopsy, sometimes the biopsy doesn't heal either.
Really?
So challenging, wow. Yeah.
Tough problem.
Issues of bleed in Ecuador. The high incidence of autoimmune disease in Ecuador makes the appearance of pyoderma gangrenosum in patients a fairly common health problem in the emergency rooms of Ecuador hospitals. This translates into a problem since these patients are not properly cared, they can catch an infection. Well, for conclusions, pyoderma gangrenosum is an ulcerative inflammatory skin disorder that can be associated with an underlying systemic disease, such as an ulcerative colitis.
What is ulcerative colitis? Ulcerative colitis is a chronic condition characterized by inflammation and sores or ulcers in the rectum and colon or large intestine. Ulcerative colitis can be distinguished based on how much of the large intestine is involved. When ulcerative colitis involves only the rectum, it is referred to as proctitis. If the left side of the colon is involved, it is known as left-sided colitis. When the entire colon is involved, it is known as pancolitis. Ulcerative colitis is characterized by periods of time with active inflammation when the patient is experiencing symptoms, and periods of time when the inflammation is turned off and the patient feels well. We call these periods of wellness remission. Many patients with ulcerative colitis have long periods of remission, alternating with periods of active inflammation, which are called flares. Some patients with ulcerative colitis have more severe flares than others. Although the cause of ulcerative colitis is not known, many factors can contribute to a person's risk of having ulcerative colitis, but most can be thought of in three categories: genetic predisposition, environmental factors, and a dysregulated immune response in the GI tract, which causes the inflammation. Environmental factors may include infections, smoking, and taking antibiotics or nonsteroidal anti-inflammatory drugs, or NSAIDs. In ulcerative colitis, inflammation appears within the colon, and the immune system works to combat the bacteria and viruses as it does with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it rids the body of the bacteria or viruses, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of ulcerative colitis. In ulcerative colitis, the rectum, the last 6 inches of the large intestine, is always involved. The inflammation may involve additional areas of the large intestine above this area. In some patients, the inflammation may extend further up into the colon, and it is thought that in some patients, the inflammation extends higher up over time. Approximately half of patients who do not have the whole colon involved at the time of diagnosis eventually progress to more extensive disease, which may result in new symptoms or loss of response to an existing therapy. Most of the symptoms of ulcerative colitis are related to the inflammation of the rectum. When the rectum is inflamed, it is not able to store contents or distinguish gas from liquid. Because of this, patients frequently feel the urge to run to the bathroom or fear that they will leak or have an accident. Other symptoms of ulcerative colitis can include frequent small stools, fatigue, low energy, and rarely fever. Because the rectum is always involved in ulcerative colitis, patients usually experience similar symptoms regardless of how much of the colon is involved. In addition to symptoms involving the colon, ulcerative colitis can affect other parts of the body. Symptoms outside of the GI tract can include joint pain, liver inflammation, osteoporosis, skin problems, eye problems, mouth ulcers, and anemia. Patients with ulcerative colitis should expect to lead normal lives. An important goal of the healthcare provider is to help people manage the disease, rather than having the disease manage them.
Thanks for watching this video.